The Senior Rehab Project is supported by the Game Changers, a group of motivated rehab clinicians that are crushing mediocrity and advancing care for older adults. You can join this group of people and get access to the private Facebook group, the monthly meetup with article discussions, and have a say in the direction of this movement. Get off the sidelines and get involved. Just go to seniorrehabproject.com/Game Changers. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults. And now your host, my grandson, Dusty Jones.
Hello, friends. This is the Senior Rehab Podcast. Thank you for listening. My name is Dustin Jones, the founder of SRP, and I am excited for you to hear today's guests. Well, I shouldn't say guests. They're more, they're taking over the show, actually, for this episode. This is going to be a fireside chat with the new president and vice president of the Academy of Geriatric Physical Therapy. That's Dr. Greg Hartley and then Dr. Cathy Ciolek. Those names probably sound familiar to you if you've listened to this podcast for a while. They've both been guests on the podcast, and they're both members in the SRP Facebook group. But we wanted to do something a little different as they kind of come into leadership, with the Academy. When many of us listening that were in New Orleans for CSM, the Combined Sections meeting, there are a lot of things to do down in New Orleans, but one of the highlights for me was going to the World War II Museum. It is an absolutely amazing museum that kind of gives a beautiful portrayal of the good, the bad, and the ugly of that period of time. Many of the patients that we have served, have lived through some of those situations, which is just mind-boggling to me. But one of the things that really stuck out to me was the fireside chats. So FDR, the president at that time, around 1933, he started these fireside chats, and they basically broadcasted these conversations over radio. So the people of the U.S. would gather around the radio and listen to their president talk to them. And now that for us, that doesn't seem like a big deal. But back then, that was such a novel and unique thing that it really boosted the morale and the unity of the country. And the beautiful thing about this, my favorite thing, is that it wasn't this kind of stiff, boring speech or address. He would literally start the talk by saying, "Hello, friends," and then he would go into, kind of his agenda. But he referenced the U.S. citizens as friends, and he broke down the wall. He made himself much more relatable, with the U.S. citizens, and I just love that concept, and I want to do what I can to do the same with our leadership within our profession. So hopefully, we'll have on some more leaders that may not have the communication lines to be able to talk with you in an informal manner. I want to give them the chance to do so. So this is going to be the first of hopefully, some more fireside chats. But I'm excited for you to hear from, Greg and Cathy. They're good people. I really respect them and their work. So here's a conversation between them on kind of their goals, their hopes, their dreams for their terms as president and vice president of the Academy of Geriatric Physical Therapy.
Welcome to this first fireside chat. So welcome to all the members of the Academy of Geriatric Physical Therapy and the non-members who might be listening too. My name is Greg Hartley. I'm the new president of the Academy of Geriatric Physical Therapy, and I'm joined today by Cathy Ciolek, our new vice president of the Academy. So good morning, Cathy. How are you?
I'm great, Greg. How are you?
I'm fine. Thank you very much. I'd like us just to talk about some ideas and strategies since the two new leaders of the Academy have just taken office. Let's talk a little bit about what our vision is and our strategies are for the Academy and where we might see the Academy go over the next 3 years, since that's the length of our terms anyway. So you want to kick that off?
Sure. Well, I think this is a great way to do it because one of our big messages I think that we want to try to get out is that how to rebrand the Academy a little bit, how geriatrics is really not just skilled nursing facilities, which we tend to think is sometimes the public impression of what we do. We still are the only section that represents people who work in skilled nursing facilities, but it's also the group that works in outpatient, who as probably sees 50% of their patients are older adults, but they really consider themselves more orthopedists, as well as home health, assisted living, hospital-based therapists in acute care who are predominantly working with older adults, or even just a little bit working with older adults. We really think the messages of positive aging and all that our profession has to offer that group is really important.
Yeah, I agree. I think you and I are definitely on the same page there regarding our communications plan. The Academy had already begun working on building a communications strategy and a communications committee, and we finalized that work actually just last week. And so I'm very much looking forward to where that communications committee is going to take us over the next few years. Engaging, I think, the early professionals and the students, PT, PTA students, and those that are in their first 5-6 years of practice is, I believe, essential. We have to make the Academy something that is exciting, something that engages that group. And I think that we're a little bit late to the party with that, but we have a lot of potential to increase our social media presence, increase our ability to do a YouTube channel or a podcast or webinars and all sorts of things that I believe that we can do in the future to really engage that young group of early professionals. And I agree with you about the potential for people to engage and ideally become a member of the Academy. Among those who don't necessarily identify directly with geriatrics. This is, I think, a huge population of people that are potentially already members of the APTA, identify more closely with, let's say, neurology or orthopedics or cardiopulmonary or whatever it might be, but don't identify directly with geriatrics because they think, oh, I don't work in SNF or I don't work with that population. And so you're exactly right that we need to expand what we talk about in terms of the aging adult. Some of the data that I received recently from APTA, I think there was a new practice survey that was done in 2017, and that data shows that 1 out of every 3 patients treated in outpatient is over the age of 65. So 33% of the population is already an aging adult. In SNF, of course, that's much higher. It's around 80% in SNF, and in acute care hospitals, it's around 50%. So whether or not our students and early professionals think that they are going to work in geriatrics, the fact is they're working in geriatrics, and they may not, again, identify with geriatrics as their chosen specialty area, and that's fine. But I think that the Academy of Geriatrics certainly has something to offer those people. And ideally, they should be keeping up with the literature that's published about aging adults and strength training in aging adults and frailty and sarcopenia and all those things that we know are so important when we're treating this population. And certainly we know that these individuals are treating that population from the data that was recently shared. So I think we have huge potential to expand our reach among people that are already members of the APTA that may be, not identifying with the Academy of Geriatrics. And I also think that we have huge potential, among those that aren't members of the APTA or the AGPT yet. And I hope that they will certainly consider that. And our communication strategy and our ideas about where we want to go with communication, I think, are in line with engaging those early professionals that I think are essential for us to stay relevant.
Well, and what I think is kind of exciting and how we need to really kind of reinforce the message is with the push towards some health prevention and wellness and really looking at public health issues, there is a big segment of people that are realizing that there's a lot we can do with healthy older adults to help prevent some of these issues. And we talked about there's a somewhat of a culture of ageism, certainly within society, but even within our profession of, geriatrics is where old therapists go to die kind of thing. And it's really not like that. And I am seeing a groundswell of interest in younger people to want to do the work that is going to be proactive and not just reactive. And I think we need to figure out how to address that ageism component in education, in residency training, and then in real world clinicians to figure out how to help them see that geriatrics is fun. It's, it's not just working with dying, that there's joy in our day every day, just like everyone else. And I actually think a lot more room for creativity.
Absolutely. I think, Dustin and Senior Rehab Project have done a great job at elevating, I think, awareness of ageism. And the ageism is really kind of pervasive, even through, as you said, throughout our own profession. And, an example of that are the therapists who see an aging adult and don't write a plan of care that is aggressive enough. It's not frequent enough. The duration isn't long enough. We assume that someone doesn't have the potential to improve just because they're old. We assume that somebody's never going to reach their prior functional level of status.
Or we have to keep them safe.
Exactly.
We can't let them do anything dangerous because we have to take care of them. No, these are people who take risks every day. And so why do we not encourage, positive risk taking and so that they can enjoy life the same way you or I do when we get in a car or fly in a plane?
Yeah, absolutely. And it's designing those plans of care that are just limiting to the aging adult is something that is unfortunately too common. And then even when we do treat them for the visits that we planned, often those sessions within the session is underdosed. And there's been a lot of attention paid to that, thankfully, about making sure strength training and endurance training is dosed appropriately. So certainly that's getting some attention. So I'm happy about that and hope that attention continues. And certainly within the academy, I plan to continue that. And social media is one way that we can do that.
But I think the other part too that Missy, I think, mentioned on the Facebook piece is I'm not sure we know the best way to engage some of these younger professionals as well. And so we're going to need to reach out and be really open to the feedback. And we want to be really clear that we want to hear from you. What is it that you want? We are both happen to be at the booth at CSM with a great young professional who had some really interesting ideas on how to engage that group. And I think we need to understand what you want us to be for you so that we can best serve your needs and help us all grow.
Yeah, that's really important. I know that we have a need to engage early professionals and students, and that is a priority, I think, for both of us. But you're exactly right that I don't necessarily have the answers in terms of how to engage those people or even how they would like to engage. I know some other academies and sections have formed early professional SIGs. There are other networking or community opportunities that we could do with early professionals and students as well. And so that's certainly something that we could do. I'm just not sure if it's going to meet the needs of what those individuals are looking for. So you're exactly right. Have them go to our Facebook page, reach out to us on email, however they would like. I'm on Twitter at Greg Hartley, DPT.
And I'm at Twin Mom Plus on Twitter.
Great. So, you can reach out to us that way. You can reach out to us by email. You can reach out to us through the Academy website and let us know how you would like to engage. I really want to engage the early professionals and students in all of our committee work, all of our task forces. You and I have already planned, Cathy, to have a strategic planning meeting coming up in a few months. And I'm very happy that we're going to invite some early professionals and students to that strategic planning meeting so that we hear from them and they become part of our communication strategy, our education strategy, our practice strategy, and all the various branches that AGPT has. So I'm excited about that.
Excellent. Yeah. And I also don't want to leave out all of our existing professionals who've been with us all this time. We're
Absolutely.
still going to keep doing all the things that you guys love, keeping the continuing education courses going. I think we're just going to be really looking at a dual fold message of how to communicate to across the generations. So
right. So in addition to increasing our social media presence that I hope is part of our strategic plan and other initiatives that we're doing, what are some other opportunities that you think exist for AGPT in the coming years?
Well, I think one of the pieces that kind of does link back to the communications plan, at least that we've had, is really just how to look a little bit external to ourselves as well. Part of what we're working on now is how to form partnerships or alliances or some other term. We haven't quite come up with what exactly is the right word, to reach out directly to the consumer to help express the PT brand and how physical therapy can help them. And I think that's been it hasn't existed as an easy pathway before, but now with some of the social media and some of the other ways that we can get word out there easier, I think those partnerships take on a really different new meaning. Mm-hmm. And we talked earlier about our education. I think we've been very fortunate to be really successful with the CEEAA program and really to help bump up practice that way. As far as education, I know we're in talks of what are the next steps with that program. Are there other options like that in other areas that we work? But also in, how we transfer that information is going to be really important.
Yeah, you're right. The CEEAA course has been very successful for the Academy, and I believe has made a difference in practice across the country. And we've been doing that now for about a decade. Mm-hmm. Yeah. And so I'm happy that coming, we think in 2019, I hope we will have a course that is based on the CEEAA that will be specifically for the physical therapist assistant. And then we'll also have a different course that will be an advanced course for those people who have already taken the CEEAA and want to sort of kick it up a notch. So those things are coming, and that will largely be face-to-face education. But you're right, there's plenty of other ways that we can expand our educational reach, and that could be through webinars and online journal clubs and a variety of different things that we can partner with APTA Learning Center and do that way as well. So I'm excited to see where the education branch of the Academy is headed, because I think there's already some good things in the works.
But some of those other partnership pieces too. I know you had some communications, perhaps with government agencies and other ways that we could take a lead. Because I think PT in general, geriatrics in particular, has been underrepresented in some of those discussions with external groups that need our resources and our thought process and our minds of all that we can do to make life for older adults better.
Yeah, you're right. The education I was talking about before certainly was internal, and I know you were really talking about external. So you're right that I think there's some huge opportunities that are in front of us with related to aging adults, and certainly at the forefront of that are payment issues related to post-acute care. That gives, I think, the Academy the responsibility to step up and be at the table and contribute to conversation around payment and policy, particularly in the post-acute setting. I mean, we are faced with a mountain of challenges in the skilled nursing environment, in the inpatient rehab environment, in the home health environment, and in outpatient as well. So it's virtually every post-acute setting that is facing some policy changes and payment changes. And AGPT needs to be involved in those conversations. I'm happy to say that we have been, and our partnership with APTA and collaboration with CMS and other entities, government entities, has increased, thanks largely to Ellen Strunk. So thanks, Ellen, if you're listening.
Thank you, Ellen.
She's done a lot of work there, and I think that our potential to grow and have a more vocal presence in those talks is going to expand. So that's something else that I would like to do. So there's also other opportunities with, I think, other government agencies that aren't necessarily related to payers. And those are people like the NIH. I think we need to partner with them about research agendas. I think that we could also just sit down with CDC and talk about their falls initiatives. You know, the PT profession has paid so much attention to the opioid epidemic, which is a worthy cause and necessary and absolutely in sort of the headline of every newspaper around right now. And that's important. But falls have been a public health crisis for decades. And somehow we haven't paid as much attention to that as we have to the opioid epidemic. And it's equally as costly. So I think we have some opportunities with the CDC related to their falls plans. I also think I've already begun some work to try to get APTA, AGPT, and HUD, Housing and Urban Development, at the table. It turns out HUD had put together a document related to decreasing falls and improving environmental safety in all of their buildings across the country. And so just last week, I heard that we have reached out to HUD and are trying to arrange a meeting with them to talk about how AGPT and APTA together can work with them on design of buildings as well as developing programs within their buildings to reduce falls for the residents who live in those buildings. And that's huge because that's a giant agency. So I'm excited about those kinds of partnerships too. And I'm also excited about sort of the other nonprofits that aren't government related at all. That's, you know, Alzheimer's groups, dementia groups, bone health groups, all of those things. So those organizations we can absolutely strategically partner with to expand our external facing persona.
And then, you know, part of the other piece that came up that, you know, sometimes a little more controversial, but what is our role in helping the clinicians who do work in some facilities to figure out how to negotiate for appropriate responsibilities, appropriate billing, all of those kinds of pieces. There's, you know, some discussion going on right now about, you know, whether to take a job in a skilled nursing facility and giving some information that was really kind of quite scary for me, and as far as supervisory responsibilities and what little treatment a PT would be doing perhaps. And so, you know, I think there is also a role for us in really trying to help facilitate what is a best practice in these settings. And so how do we then translate that into good practice in SNF and home health for working with an older adult? And, you know, that's probably more of a long-term kind of goal, but, you know, I think we can't abandon those people who need some help to establish what's the right way to do things.
Right. That's an important point. And I've seen those conversations recently on Senior Rehab Project and also in other forums. And they pop up from time to time over the years. And you're right. I think AGPT does have some role in sort of bringing to light the professional responsibility that an individual has in those situations. The Academy of Geriatric Physical Therapy is a nonprofit professional association, and so we can't change payment policy. We can't change business strategies. We can't change large corporate organizational culture. But what we can do is remind our members and our non-members who might be listening about professional responsibility, about the code of ethics, about the standards of ethical conduct for the PTA, and remind people to read those documents and understand what they say about integrity, understand what they say about your responsibility in understanding reimbursement. Everybody has a professional responsibility to understand how we are paid for our services. And so to the extent that we can change that culture, I'm not sure how much AGPT can do relative to the entire business culture. I do think, though, that we can reinforce the professional responsibility of the individual because it comes down to that. And, you know, I worked in SNF for decades. I was a director of rehab in several SNFs for a while. And I know that there are places that you can work and do this in an ethical, very patient-centered way. And I know they're out there, and I know that those places exist. And I think that we have to, the onus is on the individual. It's very hard to change something that large. So.
But I think there's an opportunity for us to highlight facilities that are doing it well, show how their business practices can be successful when it's done right, and also to provide some leadership skills and advocacy training for our members so that they can advocate for themselves and their patients, but also maybe, in the setting of how to create some culture change, even if it's on a small level. I think we have some of the skill sets, and leadership is certainly one of those areas near and dear to my heart, that all of us, as we take on new skill sets, can do a better job in our daily life.
That's a great idea. I hadn't even thought about establishing some sort of a leadership incubator or something like that to help people develop those skills for elevating care institutionally. And so that's a great idea. So yeah, let's talk more about that.
Yeah. Okay.
All right. Well, anything else?
I think this is a great start. We're a week into our, not even, our terms, but I think there's a lot of things that we can build on the strengths of what the section and the Academy has done for years under our previous great leadership. And then certainly just kind of, we're interested in broadening what we do, and this is a time for people, if you're interested in joining us and doing it, we can use your help and look forward to working with you.
Yeah, absolutely. And again, a shout out to Bill and Jill Staples, Jill Heitzman, who were our predecessors in these roles, who have done so much over the last 6 or so years in their efforts to change us from a section to an academy, and really done a lot to bring us forward. So yeah, you and I are faced with now new challenges, and really, I think, trying to expand our reach both internally and externally. So all you folks listening, please do reach out to us and let us know how you'd like to engage, what we can do to engage you with your association and with people who care about the same kinds of patients that you care about. So again, I'm on Twitter at Greg Hartley DPT. Cathy is?
I'm on Twitter at Twin Mom Plus. On Facebook, I'm Cathy Haynes Ciolek, Haines, which is my maiden name. And you can find us, contact the section office. Our emails should be available as well in the section, in the Academy webpage. And so that's another way to reach out to us anytime.
Exactly. And I'm on Facebook as well, just my name, and certainly through email as well through the Academy. So very good. So maybe we can do this again sometime for Dustin.
I think it's great. And I really appreciate Dustin taking the opportunity to help just to facilitate this for us.
Yes. Thank you very much. And we'll look forward to another chat soon.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com, where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers, where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.